Byllye Avery, born in Waynesville, Georgia, on October 20, 1937. No biological father in the picture, but shortly after moving to Florida, her mother remarried.
Sadly, when Byllye was 15, her stepfather passed away. After his passing, she was expected to take on the caregiver role. For example, if her mother asked her to make fried chicken, she would have to go out and catch, kill, clean, and cook the chicken all by herself. After high school, she attended Talladega College, which is the oldest historically black college in Alabama. She loved college life and majored in psychology. This is when she got involved in the civil rights movement and even heard Martin Luther King Jr. speak at her campus church.
After college and graduation, Byllye married Wesley Avery on June 25, 1960. They had 2 children, Wesley Jr. and Sonia. But before these pregnancies, Byllye did not know a lot about birth control. She had tried to prevent pregnancy, but she had not even known that she was pregnant with Wesley, her first pregnancy, until another woman had told her. We have a quote from an interview with Byllye in the 80s saying, quote, "I got pregnant with Wesley sort of by mistake. I was trying to practice birth control, but I really didn't know what I was doing, and I ended up being pregnant. I had absolutely no idea I was pregnant until somebody told me I was pregnant at a Christmas party. One of the women looked up at my eyes and said, 'Gal, you're pregnant. Your eyes are mighty white.' And I thought, oh, that is probably why I'm feeling bad. I was feeling so bad. I was sick to my stomach, and we hadn't thought about it. We thought maybe I had ate something and all, but I was definitely pregnant. Finally, the doctor that I was going to ask to see about birth control was a Catholic. So what do you expect?" End quote.
After college in 1971, Byllye gave her first public lecture about women's reproductive rights with 2 of her colleagues from the Children's Mental Health Unit of a hospital. When a white woman reached out to get help with an abortion, she got sent to New York because she had the funds to get there. But then Byllye heard about a black woman who reached out to get help with an abortion, but she couldn't afford the travel fees, so she tried to self-induce, and she had passed away from complications. This left a mark on Byllye and pushed her to get more involved in the feminist movement and focus on the inequalities black women face. She and her colleague Julie opened the abortion clinic after Roe v. Wade about 1 year after. She opened Gainesville Women's Health Center in 1974. This was funded to provide low-cost, compassionate health care for women by women. They held gynecological clinics 3 nights a week and did first trimester abortions 1 day a week. They accepted Medicaid payment, which made the services available to women living in poverty. They ran body sex workshops for women to learn about sexuality. They provided groups for young women and girls to learn about menstruation and have positive attitudes toward it. They offered to let women who came in for examinations an opportunity to look at their cervixes if they wanted to. And so much more was offered.
4 years after opening Gainesville Women's Health Center, Byllye opened a new birthing center for women called Birthplace in 1978. This allowed women to have more control over their experience. Byllye also hired midwives for direction and guidance during the birthing process. She decorated the center to make it more homey, and she assisted in over hundreds of births. Soon after, she began to work at Santa Fe College in Gainesville, which she helped black women stay in school, learned about the challenges black women faced in higher education, and realized that awareness needed to be on a higher scale since black women faced different challenges than white women. In 1981, she began the Black Women's Health Project, and she organized a conference in Plum College to talk about women's health. More than 2,000 women attended. This became the National Black Women's Health Project in 1984. She trained Black women in her self-help programs.
The success of the National Black Women's Health Project led to Byllye receiving a MacArthur Fellowship, also known as the Genius Grant, in 1989. Byllye used the opportunities afforded to her by the grant to travel and continue to write books. In 1990, she co-founded African American Women for Reproductive Freedom, an organization with the goal of reducing the stigma of abortion within the Black community. Throughout the 90s, Byllye worked on health projects in other countries, including Brazil and South Africa. In Johannesburg, she trained Black women in her self-help program. While the women there faced similar health issues as the United States, she also saw major impacts of HIV and AIDS in the South African community. Back in the States, Byllye founded the Avery Institute for Social Change in 2002. This organization educates Black Americans on healthcare policies. In addition to her activism, Byllye Avery is also a school teacher and mentor. From 1991 to 1993, she was a visiting fellow at the Harvard School of Public Health. From 2003 to 2010, Byllye co-led classes on reproductive health and advocacy in the Hillbrun Department of Population and Family Health at Columbia University. Her work and mentorship continues to inspire and support the department's commitment to affirm access to sexual and reproductive health as a human right. This is a clip of Megalyn, an actor, singer, writer, female activist, who is reading a clip from one of Byllye's books, Voices of Feminism.
By when white women got together, really most of the things they only wanted to talk about were reproductive issues. But when Black women got together and we started talking about health, we started talking about different things. We started talking about things that had to do with psychological well-being. We started talking about issues that were affecting our lives, violence, sexual abuse. But also white women were talking about these things, but they were not priorities. And reproductive health, Black women would use reproductive health services, but they were not priorities.
Throughout Byllye's life, she earned many awards and accomplished many things. Firstly, Byllye had served on the Charter Advisory Committee for the Office of Research on Women's Health of the National Institutes of Health and has received numerous awards for her work, including the prestigious MacArthur Genius Award for Social Contribution, the Essence Award for Community Service, and the Audre Lorde Spirit of Fire Award from Fenway Health.
She holds honorary degrees from Thomas Jefferson University, the State University of New York, Abington, Gettysburg College, Mountain College, Bates College, Russell Sage College, and Simons University. In 2018, she received the University of California at San Francisco Medal, the institution's most prestigious campus award.
Continuing her legacy is the City University of New York and their School of Public Health. They have created the Byllye Avery Sexual and Reproductive Justice Endowed Professorship. This professorship was created with Byllye's ideals in mind, to provide scholars with the resources necessary to conduct research and pedagogy that centers the experiences of Black, Indigenous, and other women of color, and all minoritized and marginalized groups of people. This professorship was meant to build a solutions-based sexual and reproductive justice curriculum, increase access to culturally responsive sexual and reproductive health services both domestically and abroad, and to prepare the next generation of public health leaders to advocate and stand up for the advancement of human rights to health.
Byllye Avery is currently retired and working on her memoir. She lives in Provincetown, Massachusetts with her wife of 35 years. They have 3 children and 1 grandchild.
Roe v. Wade had been passed, and we were starting to take women to Jacksonville to get abortions. Well, that got kind of old because we were going every Saturday either to take someone to get an abortion or to get a checkup, etc. And we started dreaming about having a clinic right in Gainesville. We opened up the center in May of 1974, and it was a first trimester abortion clinic and a well woman GYN center. The facility that we found used to be the health department, and so it had gray, awful tiles on the floor, and the walls were all gloomy gray and all, and we wanted to make it be an attractive, beautiful center. We wanted to demedicalize it. So we got shag carpet and put on the floor, which was just, the cat's meow.
Byllye's dedication and contribution for change will forever be remembered in and outside of the Black women's healthcare community.